Well, I think we should get started. Thanks everyone for joining today's seminar. Abhinand is going to be presenting on a project in partnership with WRI on interventions to reduce air pollution in India. So Abhinand, please take it away.
Thank you, Jesse. Yeah, as Jesse was mentioning today, I just wanted to share a little bit about some work I've been doing for the past year and a half. I actually used to be at WRI until March last year. It's my first work anniversary at EDF, and I'm really happy to be on the other side and working very closely with our science team on this project in India. So this is a project in a particular Indian city where we're working on a pilot project, just exploring ways to or identifying actions to reduce air pollution, particularly from the transportation sector in the city of Indore, which has been deemed India's cleanest city. So I just wanted to share some experiences from that, some takeaways from some of that work that might be relevant for anybody who's in the sort of like program portfolio management space. Yes. Just share my screen to folks. All right, I hope you can see my screen, and I do apologize for the bare bones template. I didn't want to go rogue with it. But yeah, so one of the key things that you would have, I mean, I'm sure by now everybody would have heard about like Delhi being, smog chamber, and like it's been in the news for a long time. So this is just to contextualize the kind of air pollution, or sorry, air quality management planning approach that the Indian government has been piloting, and how we have been sort of supplanting some of that experience and some of that planning approach in this Indian city I was talking about. And in a lot of cases, as you would have also known about a lot of planning that takes place in global south cities, the framework exists, but in terms of filling in the gaps, organizations like EDF play a major role in actually ensuring that we build capacity, knowledge, and also bring in like a sufficient coalition to bridge those gaps so that actions can be taken. So this is a little bit of a reflection of that kind of experience. So before that, I wanted to also, I'm sure this might be familiar for a lot of you. If it is, please, I do apologize. But just to sort of orient you towards the health risk that air pollution poses at a global level, as you might have seen from the Global Burden of Disease study that was released in 2019 and 2020, air pollution compares very much, in close contention with other leading causes of death globally, like high fasting plasma glucose or diabetes mellitus, as well as diabetes mellitus and type 2 diabetes, as well as several other risks that are causing a lot of, mortality and morbidity risks to human well-being. And at this juncture, I also want to say that, a lot of this sort of context-orienting information was put together by Dave Anshuman and I together for some other project that we were working on. But this, again, before I jump into the sort of nitty-gritties of what sectoral contributions are, this is just to sort of also orient us, given that we're soon approaching the International Day of Clean Air for Blue Skies sometime in September. And recently in UNEA at Nairobi, a very remarkable resolution was passed, really highlighting the linkages between air pollution and health. So this is just a reminder. So amongst all the air pollution related deaths that we can track in the world, which is close to 7 million, we see that a lot of those are caused particularly by ambient PM 2.5. As many of you know, PM 2.5 is this, is a particulate matter that's, as thin or less or thinner than a strand of hair, and can cause a lot of damages to your lungs, to mental capacities, and can also exacerbate diabetes, cardiovascular disease, and COPD, and several other risks. And so, it doesn't mean that household air pollution or indoor pollution does not cause a risk to mortality. It still does in a lot of global south cities, particularly where, clean cooking is still not accessible, either due to cost reasons or due to sort of servicing and availability and the lack of government services. But primarily, we're concerned with ambient PM 2.5 when it comes to health risk currently, both in the Indian context as well as globally, as we're planning and as we take forward guidances by WHO and several other organizations. So within this, where does India fare? We see that, as you can see, some of these lines, which might be confusing. The blue line tells you the annual average PM 2.5 concentrations in India since 1990. So 1990 is one of those marked here as a beginning starting point, because That's when we liberalized our economy and started to see a lot of industrialization processes, and also air pollution made its mark in our 5-year planning processes, similar to China's 5-year planning processes for the first time in 1990. And since then, we've seen that, as opposed to the contribution of, sort of indoor air pollution levels, we've also seen PM 2.5 levels sort of stagger and reach an annual average of about 83.2, which compares very poorly with the PM 2.5 standard that the WHO has prescribed. Now, why does this PM 2.5 standard prescribed by WHO matter? Because it's one of those standards that guides global air quality management, given that, this is a level that's been determined as posing a potential sort of like, an opportunity for us to save lives compared to previous levels of exposure to air pollution that are deemed dangerous. So this level of 10, which was effective until 2019, since about 2005, had been recently revised to 5 micrograms per cubic meter. And the US EPA is also, as a result of this regulation, recently updated its standard to 9. So, these are all levels that are deemed as the minimum accepted levels for ensuring that healthy lives are maintained, which is a big objective of both the Indian government as well as our work on the Healthy Communities team. And I'm guessing all of us here at EDF. And, as a comparison, the national air quality standard in India is actually 40 micrograms per cubic meter, which is almost 4 times the safe limit set by WHO, which is notable. And, similar to China, where, even though they've halved their emission standard still is on the higher end and not at the 10 micrograms per cubic meter level. It goes to show that, we need interim targets as well, similar to the one that the Indian government has taken, in order to ensure that we have a sort of, you were accounting for growth aspirations, particularly when it comes to developing and emerging economies. That said, given the sort of exposure to PM 2.5, we're also seeing that, over time since 1990, we've seen really a reverse sort of relationship between the number of deaths that have been attributable to indoor air pollution, given, cooking stoves and solid fuels for indoor combustion, and, the sort of PM 2.5 related ambient PM 2.5 related deaths. And we see that they've hit almost 1 million in India as of 2019. And this is definitely a cause for concern. And that led to the formation, actually, over the past few years, having sort of assessed this kind of data that's been generated by the State of the Global Air team at the Health Effects Institute, as well as the Global Burden of Disease study and several other journals like Lancet, having produced landscape studies across countries on mortality risks of air pollution. There's been a lot more interest from the Indian government since at least the past 5 years to set up a more central program for managing this air pollution problem beyond just, thinking about Delhi and those sort of cities on those areas. So the project city that we're working in is called Indore. It's in central India, and it's been India's cleanest city for 7 years in a row. And as you can see in this map, the maps above the 4 lines show you the average PM 2.5 annual concentrations of 4 of India's most polluted cities. One of them is also the world's most polluted city. That's the Delhi NCT region, especially when you take into account the winter fluctuations in these concentrations. And Indore is, very close to the actual national standard of 40 micrograms per cubic meter. And so, in a lot of instances, you could argue that, a city like Indore should not have to worry about air pollution. But contrary to that, the city government has been, over the past decade or so, been very aware that, air pollution is one of those areas where it's failing, because particularly during winter, you see a large uptick in annual average PM 2.5 concentrations, either due to heating sort of needs, or in terms of like, the sort of addition in transportation and agricultural burning and several other causes. And so the city has been engaging with us since the launch of our project in making sure that not only do they comply with the national standard over time, but they also do better, because they've been #1 in a lot of other cases and been a model city for 600 other cities in India. And so they're aspirational in terms of being, wanting to improve their air quality as well. So as I said before, the air quality guidelines set by the WHO was recently updated to be 5 micrograms per cubic meter. So one of the messages that we've been conveying to the city authorities is that, by meeting some of these prescribe safe standards, they are able to save a lot of lives and life years. And so that's kind of what we see here on this graph, and something that we're using regularly in our messaging particularly with health authorities. So, this is data that's coming from the AQ Life Index work that the University of Chicago had done, the group led by Dr. Michael Greenstone and this EPIC Center, Energy Policy and Innovation Center at U Chicago. What they've did is a landscape study across all countries in the world, projecting what would be the number of life years saved per individual if they were to meet WHO safe air quality guidelines. And we see that particularly for cities like Indore, which are still tier 3 cities or smaller size cities in comparison to larger cities like Delhi or Mumbai in India or Shanghai in China, they can still save a lot of life years. Or basically what this means is that life expectancy can still be improved as a result of improvements made in air quality action. And so this here basically shows you that, if Indore were to hypothetically meet the WHO air quality guidelines, in 2021, we could have saved close to 12 million life years. And, for those of you involved in sort of valuation studies of, life and life years, you'll know that there's a cost associated with through VSL methods as well as DALYs. And so these do account for a lot. I don't have the number on top, at the tip of my fingers, but there is an Indian value for VSL and DALYs that, we could use to potentially arrive at what this value could be for Indore. And even with meeting the national air quality guidelines of 40 micrograms per cubic meter, Indore could still save about 1.2 million life years. So unfortunately, we don't have data spread across age groups. So it's hard for us to really calculate what the value of a life year is for somebody in the age group of 0 to 20, as opposed to maybe like 60 to 69. But essentially, the idea of some of this messaging that we're taking to the health department in the city is that, every life saved is a life saved, and that there's a lot of value in ensuring that air quality action can be more ambitious in the city government. And they've been very open to hearing more of these kind of messages. So we work within the framework of the National Air Quality Management Framework that's operational in India. So here I'm just giving you a sense of how it compares with USA, Europe, and China. Of course, these are not all comparable geographies, but this is just, based on the kind of best practice cases that we have, particularly when it comes to, the level of ambition that the USA has. Increasingly recently with the sort of reduction in its standard to 9 micrograms per cubic meter, which I know that EDF has also produced a lot of analysis showing the kind of health benefits that are associated with that kind of reduction from the earlier 12. And also in the EU, there's a new proposed regulation to reduce it to 10 micrograms per cubic meter, which is still in compliance with the 2021 guidelines of the WHO, but still shows more ambition than previous standards. And in China as well, it's the air quality levels, the annual average PM 2.5 levels have reduced from almost 75 at the peak of 1995 when they started their 5-year planning process around air quality management, to now closer to 35 to 40 average. And the ambition right now is that, particularly for cities that are early movers in air quality management, that they hit a 15 microgram per cubic meter level. So these are, targets, and many of them might be interim or, set in stone, particularly as in the case of India, it's right now an interim target. But in addition to just setting the target, cities are empowered with having planning processes through the central government managed by the Ministry of Environment. And there are also financial rewards, for example, for attaining some of these standards. And what all countries managing air quality do is that they, obviously divide cities in zones based on either their attainment or their compliance with the national standard or their non-compliance with the national standard, so that, you know what kind of resources to allocate to whom from a point of view of equity and the need also. And also, the interesting thing in India is that, there is no financial penalty per se for non-compliance. And so that is another area where we're engaging. And that doesn't mean that we're saying, penalize everybody you can who's not, who's polluting and who's not being taken into account. But rather the idea here is that from a national government's point of view, in terms of maintaining accountability, while there are rewards for compliance, there's, unlike other countries where there is potential risk of losing funding. If, for example, in the US, as well as CARB and several other bodies have sort of been very proactive about, is making sure that county administrations are ensuring that they meet a lot of the plans that have been outlined even for school districts in an effort to make sure that their funding is guaranteed. So that kind of a stick is not present. And so it maybe takes a city like Indore, which has some of that civic identity very much on, its sleeve when it comes to thinking through some of these air quality actions. And I do not exaggerate. Having had the opportunity to visit Indore and speaking to several stakeholders over a period of 2 years, it's very evident that, it's one of a kind in terms of, it's an outlier in terms of the kind of, city planning processes and the appetite that like stakeholders as well as the city government has for planning for clean air. And so with the absence of that, bigger cities are unable, like particularly like Mumbai and others, are not incentivized as much to actually comply with standards or even plan for compliance with these standards. So given these caveats, we, as I said, are working with a city that seems to be an outlier. But again, just to give you a sense of what the state of the program seems to be across the board in India and 600 other cities, as I mentioned. Out of the 600 cities in India, more or less, about 132 were mandated as being not compliant in 2021 based on the national standard levels. And they were all mandated to create plans of actions to reduce their current PM 2.5 levels by 40% over the next 5 years. And what we see right now is that since the launch of the program in 2019 to today, we just had a report launch from the government today showing that, most cities, more than 70% are not meeting those standards. And so, meeting those extended standards of 40% reduction by the next 5 years seems like a, big sort of ambitious task, primarily because, only 8 of these 132 cities have been reporting, their sort of annual average PM 2.5 concentrations and in a continuous fashion. And by that, I mean, if they started in 2015, they have data that's updated till 2024. In a lot of instances, the data monitoring equipment has been sort of, obsolete or they've not been well maintained. And so there's not that continuity of data, which, hinders a lot of planning and action. And also what's worrisome is the fact that, even though funding is available from the federal government to the states, only about 60% of the cities are using the funds allocated to them per year. Indore is one such city where, despite having funding, there is a lot more need for guidance for them. And that's the guidance that they've been asking us as well. We've been consulted into the process of where that, that funding could be used and what kind of tools and data tools can be, can help them sort of better plan for some of their actions across sectors. So the large sort of pillars of the tools, as I was mentioning, are, number one, a source apportionment that really tells you what are the main pollutants, what are the main, like I'm talking about, like, is it PM 2.5, is it PM 10, is it SOx, is it NOx, right? Like to find out really what are those large scale pollutants of concern for the city that are, beyond even thinking about like which are the key sectors. That a lot of it is also measured in the emission inventory. And also the importance of a monitoring system. So, most cities have been mandated to have a monitoring system to at least monitor PM, particulate matter, and carbon monoxide and black carbon. And also to publish clean air action plans annually and to consult stakeholders of the general public in meeting those kind of requirements. This is where the Clean Air Catalyst that the Global Health Clean Air Team at EDF comes in, because, as with many other cities in India, in Indore as well, all the 3 pillars that I mentioned on the left, source apportionment, the emissions inventory, and the air quality management systems were not present prior to our intervention. So the project that we started in about 2019, I think end of COVID, or no, before COVID, I'm sorry, was when the project was being planned. And we realized that all these, like the source apportionment, which tells you the key critical pollutants to focus on, and the key sources that contribute to these pollutants, both of that data was not available. And if they were available from 2012, and also were not, spatially sort of like, spread out. So you didn't have insights into which ward is an administrative sort of equivalent of a neighborhood or a census tract. So figuring out like those kind of insights was impossible because that data was not compiled for a city like Indore, which still falls under the tier 2. Which means it's not as big as Delhi or Mumbai, as I was saying. And so some of these data challenges were very imminent. And similarly with the air quality management system, which was not present. And so we launched the Clean Air Catalyst in 2019-2020, funded by the USAID. And we launched this project not just in Indore, India, but also in Jakarta and Nairobi. A lot of my work over the past year and a half has been with the city in Indore. I've led some procurement work for Jakarta for these air quality management equipment that I was just talking about. But, a lot of my work around like thinking through these solutions has been in Indore. So I'll be talking about that primarily today. So WRI and EDF are the lead grantees in this project. And I'm just giving you the sense not to like bore you with like project management related information, but mostly to just give you a sense of like how this program is structured and where different sort of inputs come in. So we're a large project about like, 50 to 60 members. And so where I come in is in helping think through these solutions. And so a lot of my work is not necessarily economics, but more so policy, if you will. And we have a large, a sector of scientific partners like Columbia and OpenAQ, who are all modelers that help us fill this gap of not having sort of clear information on what are the sources. So we resort to a lot of chemical modeling to understand some of these sources. And so the Clean Air Catalyst was launched with the vision to plug these data gaps and also take us from these, understandings of the sources to actually figuring out what kind of actions can be helpful, either at a pilot scale or even at a citywide scale. So right now we're thinking through a lot of these solutions at the pilot scale because of feasibility constraints. We are in year 4 of a 5-year project and, funding is running out. So there are lots of those constraints. So we're working within those constraints as well as expectations from our, you can call it the client or the agency that we, have a lot of frequent engagement with, which is the city agency in the city of Indore. And so we're currently in a sort of like complex mesh of like figuring out what's best in terms of the city's needs as well as for our donor. And so it's within this that, a lot of the work has been done. So I want to add that as put that as a caveat right at the outset because of both data unavailability as well as some of these constraints in terms of thinking through our ambition and justifying it. Sorry. So the project approach has largely been, as I said, to first understand these key sources and also to understand what are the root causes. And in a lot of cases, at least in the way other cities have done their air quality management planning in the Indian context, it's been straight from sources to solutions. And that's why a lot of these actions have not taken off. For example, the biggest sort of action that was initially touted as the solution to solve the air quality problem in the city of Delhi was the odd-even policy, which is kind of similar to a lot of other iterations of that. For example, Ciudad de Mexico had this, Mexico City had this project called the No Hay Circula, which basically means that cars with registrations ending with an odd number would not be allowed to ply on a particular day of the week. And then cars with even number registered plates would not be allowed to ply on a different day of the week. So those kind of solutions were seen as a way to reduce the amount of like sort of VKT, particularly by vehicle kilometers traveled by passenger vehicles. But those programs did not take off primarily because, there was not an understanding of the root causes within a sector like transportation. And there was not enough of a deeper understanding of different fleets and also political economy constraints. And because, as it happened in Ciudad de Mexico, as well as in Delhi, what it actually led to was a proliferation of vehicles because, people did want to have 2 cars. And so they had, people did want to get to different places, particularly in a city like Delhi in 2012, when the metro was had just been launched and still was, sort of out of reach for a lot of populations. What it led to was the proliferation of vehicles. So to right some of those wrongs, the project was designed to ensure that that kind of like, rigorous deep thinking around what, political economy considerations and feasibility considerations were taken into account. And so once we understood some of those root causes for why there were persistent causes of the source being a source activity, we then went into like a consultation mode with a lot of our stakeholders, the city agencies, as well as transportation stakeholders, stakeholders in the industrial bodies, stakeholders in, social services like, public utilities, service providers, associations, as well as, even people in the construction industry to understand, their sort of concerns when it came to thinking through solutions that would help reduce emissions in their particular sectors. And post that, we then also identified actions that would have the highest impact based on our estimations of how these actions would lead to emission reduction pathways, particularly for PM 2.5 as well as for climate emissions. Particularly, I'm talking about like GHGs. So, what Indore did have was a climate inventory. And so a lot of the information was used from that inventory but also with that inventory, we only had data on like large scale contributions of sectors and not fleet wise sort of divisions. So really the sort of like, specificity of information was lacking. but we had to really work with those constraints while we pursued our own sort of data collection activities. And what I'll talk about later on towards the end of my presentation is some of those takeaways on how timing the science part of the activities and the solution planning is very important, something that did not unfortunately happen in our case. And the ultimate idea was to, not only help implement through a pilot, but also build a lasting solution coalition around that action. Oh, I see I'm kind of inching closer to the end of time. I will just take 5 to 7 more minutes and then wrap up. Right. So we talked a little bit about identifying sources. And so, like I said, about root causes, the ways we did it was applying some political economy sort of frameworks that were given to us by some of our partners at Columbia. And so we used a combination of stakeholder consultations as well as our own data, market research data on things like fuels, fleets, and other available data on, contributions to emissions, or at least, sort of the growth rates of particular vehicle counts within a fleet, and data like that to basically give ourselves an understanding of what kind of actions would lead to actually reducing emissions in a sustainable manner and not contribute to some of those sort of like circular instances that happen with the LEZ, or the entry-exit regulation of passenger vehicles, as I mentioned in the Delhi case. And so in addition to that, this root cause analysis also helped us identify ways to make sure that these solutions were equitable. For example, when we were looking at solutions in the case of waste burning, as well as in this example, the transportation, as you see here, we saw that, the general approach of the government was to always penalize and ban and older vehicles, or in the case of waste burning, to penalize largely people who were from the lower income category, penalize them for open burning of waste. But then we understood that sure, penalties do work in a lot of cases, particularly from a point of view of generating revenue for additional investments in air quality management. But what they were doing was exacerbating existing inequalities. And when we spoke to a lot of these stakeholders on the ground and did a couple of surveys, trying to understand better why they were, sort of doing these so-called polluting activities, it was found in the case of waste burning or open burning of really sort of biomass and waste, was that it was done because there was there was a lack of alternatives when it came to heating options, particularly during winter. And so people had to resort to whatever material they had access to insulate themselves from the cold temperatures, which last about 3 to 4 months in indoor. And so penalizing them for doing something that they're doing really for subsistence was kind of worsening the problem and leaving the others, sort of the people who might actually need to be punished or penalized, sort of leave the system. And similarly, with the case of the sort of scrappage of old vehicles, that was always a sort of go-to for the Indian government in terms of encouraging newer vehicle adoptions. We found that, again, for a lot of taxi operators and others who are running vehicles that are older than 15 to 20 years. And for example, taxi operators or taxis make up close to 4% of the fleet in a city like Indore, right? And so among that, more than 60% of those vehicles were older than 15 years. And so technically had to be scrapped. And so one of those action planning items on the Indore city's mind was to scrap these vehicles. But, there was no alternative to provision of maybe subsidies or other opportunities for these taxi drivers that are in the sort of below or closer to the poverty line sort of strata of income category to, access alternatives or purchase newer vehicles, which was seen as the other option. And so we see that, there are opportunities to ensure that, the solution that's finally implemented does take into account some of these root causes and potential negative sort of harm effects that we usually don't think about or is not documented at least. And so we created like a root cause map like this, which goes into detail into the multiple different potential causes of transportation related emissions. Particularly, I'm talking about exhaust emissions from different fleets at different hotspots, because we were asked to think through interventions at the hotspot, because the city had previously thought through fleet-based approaches. And I'm talking about, fleet sort of sweeping actions like, electrification of buses to meet a 10% target was one of those actions. But the problem with actions like that was that they were not feasible and there was not a real action or feasibility plan or a plan of action to meet those targets. And so we were post consultations with members of parliament, with city authorities, as well as, sort of like transportation department officials. One of the things we were asked to do is think through solutions that could combine some of these fleet-based actions, but using the intersection as the sort of approach or the vehicle where, you could sort of implement some of these emission reduction actions. And so one of the largest, and so I'll skip ahead to thinking. So this is just to give you a sense of the types of meetings that we had. And, so there's been a lot of stakeholder engagement on the ground, thanks to our India team that's been on the ground. And I'm also very grateful to Carolyn and to Dave and the economics leadership team for giving me the opportunity to be a part of some of these meetings, where it's been great to really see, how we're responding to requests from the government, as well as sort of requests from, civil society organizations on what would be really priorities for them. So we took all of that into account, and then also took into account things like, scalability, as well as the potential for multiple benefits. One of the things that we were focusing right from the beginning was to ensure that our actions were delivering as many co-benefits as possible, measurable co-benefits, particularly on gender, on equity, on climate and health. So we have a gender and equity person on the ground in India, and I'm responsible for measuring some of these climate benefits, as well as working with our healthy communities team on sort of thinking through these health-related outcomes. And we also wanted to make sure that we identify a solution or a set of actions around which we could actually build a coalition that would last post the life of our project. And so we used a lot of data on data that we could find on mode share, or data that we constructed in some cases on mode share, in particular sort of intersections that we're talking through, where, some of these intersections were, interventions were being planned. And that was done with extensive vehicle count analysis on the ground, which really means for 8 hours of the day, sitting in an intersection and, trying to count the number of vehicles of a particular fleet or sub-fleet entering through that intersection. And in the absence of data that, could really point to spatially sort of spread data from inventories, this is the kind of approach that we had to resort to really get a sense of, sort of what is the potential impact that we could have on emission reduction in some of these intersections. And then we went about trying to understand what these impacts would look like and trying to measure them. So we had a whole set of actions, particularly for idling, given that idling was seen through some of the initial insights from our emission inventory work on being a good contributor, being a substantial contributor to PM 2.5 emissions, especially tailpipe emissions. Given that, these are sort of concentration areas, and idling time in a lot of intersections in the city of Indore were more than a minute long. And so that meant that, and with engines not being turned off, idling, which seems like, not that big a contributor, was seeming to be still an action where there might be a potential sort of quick win, which is also something that the city was interested in. And we also had specific actions targeting vehicle classes in the commercial vehicle sector. I'm talking about large trucks and lorries that ply in India, which are also interestingly 15 or 20 years old and technically need to be scrapped. And so we understood that, the option was either they replace their vehicles, which is the city's mandate, or they retrofit. And so, to explore some of those options, as well as for light commercial vehicles where electrification was already something that was picking up in the city, trying to identify what, in terms of deployment of charging infrastructure and the sort of available subsidies based on other subsidies, could be modeled to ensure that, small scale light commercial vehicle operators could take forward or could sort of accelerate the rate of adoption of electrification, or at the least CNG adoption, compared to diesel and petrol. So these were some of the actions that we identified and, sort of quantified through a set of assumptions based on data that we had on market trends, as well as data from other states on sort of what they were observing as a response to subsidies and things like that. But the largest sort of action that we really saw contributing to emission reduction was public transportation improvement, because, a lot of the vehicle kilometers traveled were with private passenger vehicles. Particularly, I'm talking about two-wheelers, which are voluminous in the case of Indore. They make up more than 6 million units in the city of Indore itself, and the number of registrations of these two-wheelers, particularly diesel and petrol, and now increasingly even EV sort of two-wheelers, has been, it just keeps increasing given the sort of cost affordability, as well as the ability of these vehicles to navigate urban streets in cities like Indore, which particularly when it comes to getting to peri-urban areas and areas within the city, there are not quote unquote well planned. And so the goal was to shift more than 1 million of these vehicle kilometer traveled of private passenger vehicles to public modes of transport with route coordination, as well as, other schemes that were being planned by the city, but not really taken to fruition. Things like common fare cards, which really integrate a lot of the transport modes, talking about metro, buses, as well as last feeder connectivity options. For example, in a lot of metro stations and public bus stops in India, increasingly we see a lot of three-wheelers playing as last mile sort of connectivity options. And so thinking through all of these and really quantifying the number of such stations that would be available is some of the work that we've been doing. And also enforcement of vehicle testing, which has been sort of a failure in the Indian air quality management experience overall, considering that only 5% of vehicles that test for their compliance with vehicle emission standards like Euro 6 or Euro 4 really fail, because there is an opportunity for actually tinkering with the results. And so even these 5% that fail do not always get met with remedial actions like retrofitting or replacement of vehicle. And so this is one of those solutions that we were asked to model by the city government, but could not really, so we did our best to find out what are the ways to improve capacity of testing centers, to see if that, along with other sort of, incentives, could help really improve testing and what happens post-testing in terms of remedial action. And we quantified that. So this is work that I've been doing with Ananya Roy and Tammy Thompson of the EDF Global Clean Air team, with input from our transportation expert, Azra Khan, at WRI India. And so we found that a lot of our actions would contribute to about anywhere between 2.5 to 4% or so of the transportation related emissions that are trackable to PM 2.5. Again, given that a lot of our emission inventory work is still ongoing, we're unable to report on what this means for citywide emissions. And so this is one of the challenges again that we're working through. So as this is a pilot level intervention at only a specific set of intersections, there is potential, there are discussions around how do we scale this sort of action. And I'd love to get also your thoughts, those of you working in the transportation sector, or even those of you thinking through questions of scaling particular policy approaches into what kind of methods or ideas I can think through to ensure that we are able to really project out what an intersection level approach could look like from a scalability point of view into 10 intersections or the citywide itself, because that's one of those sort of methodical constraints that or challenges that we are thinking through at the moment, given the sort of paucity of data or the kind of data that we're generating. So I know I'm a little off time. I'm just going to wrap up with these sort of key takeaways from this exercise that we had. I'm talking about the exercise that I just presented a little bit. I apologize for rushing through it. Again, maybe a lesson for me to plan this better next time. But one of the things we understood very early on is that working in silos, because the way the project was structured was that we would have one partner, say WRI, contribute to solutions, and the EDF partners contributing to science, right? And so the solutions team people, which previously included me as well, would work on really designing these solutions from the lens of urban planning, as well as trying to understand what works within the Indian context, looking at other city examples and available data. And the science team would come in when the input from inventories and source apportionment studies were available. So given a lot of the sort of COVID-related challenges that we faced in 2020 and 2021, our timelines for actually publishing insights from and even collating insights from the emission inventory and the source apportionment studies were much more delayed. And so we only got these results very recently. And as a result, what has ended up happening is that, a lot of that input could not be fed readily into the process of developing these solutions. So we're currently actually tinkering a little bit to add particularly actions that reduce road dust, given that we're now seeing that road dust is a big contributor to some of these PM 2.5 related emission reduction targets that we want to meet. And so this is one of those things that we've understood as a project and as a consortium of partners, which is a complex thing to navigate, to figure out when do we ensure that science input feeds into it, or, really input on things that are not so siloed, and also navigating some of these sort of expectations on versus our donor versus our client and several others. So as I said, this work doesn't happen, by an individual. It's a team effort. I'm so grateful to get to work with these people. And as I said earlier, I'm grateful that the Econ leadership gave me the opportunity this February to actually take part in one of these workshops that happened in the city of Indore, thinking through these solutions, and also getting particularly stakeholder feedback from the point of view of assessing equity impacts from women who are involved in the transportation sector in different capacities. Thank you very much. I'll just stop with this slide in case there's the need for discussion questions. Thank you.
Thanks so much, Abhinand. I think we have just over 10 minutes for questions.
I'll go ahead and jump in. We can't cover it all. This is a fantastic presentation, a bit of a tour de force. I just wanted to reach out, Abhinand, to say I'd be happy to meet with you subsequently to talk in some detail about some of these elements, some of the experience with some of the emissions control strategies for the vehicles, some of the equity considerations. I'm curious if you've heard from others around this goal of 12% CNG light duty vehicles, and if there's an opportunity to skip over that goal and go right towards EV, since we know those CNG vehicles leak. But I really just wanted to make sure you heard me. That I look forward to chatting in greater detail at another time.
Thank you so much, Jamie. Yes, I would absolutely love to take this offline and get your insight, especially given your work thinking through some of these like clean fuels. And to your point on CNG, I totally agree. But we're tied down in that sense also because the city of Indore has just commissioned about a 7,000 crore, which is about, I think, $1 billion CNG plant to produce compressed natural gas from biological sources from their waste generated sort of product. So in a way, it's a win in terms of recycling that waste, but in other ways, I do get it. It's important to sort of switch over and get to the cleanest possible option. But given that EV charging infrastructure is also very scarce at the moment, it's kind of being one of those things that we are having to navigate. But I hear you. Thank you.
Dave, go ahead.
So first, I wanted to thank you, Abhinand. Thanks so much for this presentation. And it's been a real joy to follow your work throughout, our conversations. So I've really been enjoying that. I had two questions, and I think these are questions I've asked before. So I'll just ask them in a public setting and see how other people react. But one of the things that you just mentioned, which I hadn't actually considered this until I looked at some biofuels literature. If you're capturing the gas and it would have otherwise gone into the atmosphere, that's it's really good, actually. It's reducing potentially methane from going into the atmosphere and capturing it and using it as gas, potentially displacing a fuel, which is like the low carbon fuel standard, similar to that. So that it'd be great to get a carbon intensity measure on that. And maybe even looking at the LCFS might give you some ideas on how to construct that. But then the other question was, what happens to all the other vehicles that were tuned for gasoline? Are you because there's this idea that you may not be replacing the vehicles that are there, you may just be adding more vehicles. Do you have anything on that? Have you addressed that in any way, or has your team addressed that?
Yeah, thanks, Dave, for those questions. And I think to your point on, sort of the methane mitigation potential of bio-CNG, yes. But I think one of the things that our scientists on EDF have also been highlighting with regard to the sort of bio-CNG and CNG part is that there's been some hesitation when it comes to actually figuring out if there are potential methane leakage consequences when it comes to deploying some of this bio-CNG in three-wheelers and buses, where that sort of methane leakage or fixing that leak is not the technology to fix that, similar to how we have CNG buses in the US that have sort of managed to do that, is not always present, or it's not sort of guaranteeable. So that's one of the concerns as well. But we're not able to push back given the sort of large investments in bio-CNG and also the fact that this is a 20-year contract to produce bio-CNG. So at least for the next 20 years, CNG is still going to be a part of the fuel mix when it comes to transportation in the city of Indore, whether we like it or not. And to your point on sort of what happens to the existing vehicles, I think I might have miscommunicated. So what we are talking through is really figuring out the transition of the diesel and petrol vehicles, which are still more than 60% of the light commercial vehicle sector, into CNG as much as possible, given the sort of interest that already there has been. And so really hitting about 12% of the sub-fleet as CNG vehicles is kind of the target, and also with electrification with a similar sort of value. And that's because we're already seeing close to 5% of the LCV sector. And by LCVs, I'm really talking about like three-wheeler vans that are very common in India in terms of like, delivering your Amazon orders. Those are the vehicles that do it, not the large trucks or the kind of vehicles that fly around like UPS. We rely largely on those sort of three-wheelers and those sort of like motor vehicles. And so, the idea is to convert in line with some of the targets that have already been outlined by the city, to make sure that we have a 12% sort of LCV share being held by CNG fuel vehicles and 12% by electrification. And that seems promising given the sort of ongoing momentum. But that's how we're thinking through it right now. The pace of transition is still slow, considering that, there's also a large second-hand vehicle market. And so with the kind of vehicles we're thinking about right now is new registrations. But also one of the things that we're trying to plug into is the second-hand market, where we're unable to identify really how many vehicles there are. There is registration data, but a lot of the registration data is also not always digitally maintained. We have this portal called Vahan, which really documents registration data across years, but there's no sort of continuity in terms of what happens after a vehicle is scrapped, or if a vehicle loses its registration license. They're not always taken off the database. And so we're not always able to track really to the last sort of single vehicle. And so some of these targets had to be broad. But, I hear you. And that's one of those things that we want to really think through, is to figure out, in the absence of that sort of tracking, what kind of information we can source from some of our trucking operators and these sort of like small scale LCV operators, in terms of understanding what their challenges are, either in CNG adoption or even figuring out, how they can help meet these targets. If it's like, a problem with subsidy, or even if they're hesitant to sort of electrify due to some maintenance related costs, which there are none, but there are still sort of misconceptions around that, which we're trying to solve by providing some kind of insight into what sort of, life cost would be of an EV vehicle over 20 years as opposed to a diesel or a petrol vehicle. So, those are things that we're still working on. I hope I somehow answered that, or I will get offline during our check-ins to answer them.
Shall I go again, unless there's other people in the queue, Jesse?
Go for it, Jamie.
First, Abhinand, I wanted to give you a piece of advice. Oops.
Yes, please.
A piece of advice for everyone for when you do these seminars. What you know this material better than anyone, but this next 5 minutes is your opportunity to get a lot of questions in and comments from your colleagues. So try to just receive and not respond in any kind of long-winded way, right? So enough said on that. Like, try to hear from your colleagues. And then darn, I forgot what my other comment. Oh, I know. For city-specific actions, are you familiar with the California Carl Moyer program that gives guidance to how you calculate the cost benefits of diesel emissions reductions programs? And if not, I can
No,
that.
Yes, that would be great. That would be really great. Thank you.
Okay. I'll let others chime in thoughts.
Jamie, did you want to ask your GREET question too? You're muted.
Sorry. GREET was a tool developed by Oak Ridge National Lab to estimate vehicle emissions, both upstream and tailpipe. And what it was missing when we were working with it a couple of years ago was a module to represent different types of electricity generation mixes. So I have a version of GREET that can do that. So if you're in an area where you have a very coal-intensive generation mix, obviously you're not going to get the emissions benefits you're looking for or going to get if you have a renewable electricity generation mix. So partly is you want to do EVs now or in the future when you have a greener grid. So I'll provide that tool. I'll send it to the link so everyone can see it if they want to.
Thanks so much, Amy.
Dave.
That's a super interesting point. I didn't really consider that, Jamie, about the generation mix. It's like, is it time to go to electricity, or is it time to do something else that might be better? I think, at least in California, what I've learned about is the methane digesters, they have like a negative carbon intensity because that methane would have gone into the atmosphere anyway. And actually, I mean, it's a point of contention, like what that negative number should be. How big should that number be? Is it negative 390 grams per megajoule, or is it like negative 200 grams per megajoule? And sometimes it is negative, right? Like, but I feel like in this case, it's like you could like you could probably come up with a measure that wouldn't be too far off if you know, if it's like, I don't know exactly the nature of the gas, but Abhinand, we can talk about it and see if we can find a way of, back of the enveloping this. And then also maybe doing what Jamie's suggesting is like using a GREET model or using something similar to get the emissions intensity if you were to go electric. And then you might actually have like a pretty good justification, at least in the short run, for an investment that might change